Getting anxious because you're asked to insert a catheter for the first time? In this video, we will learn about sterile techniques for catheter insertion. There's more than one way to do this correctly, as long as you maintain a sterile technique throughout the process. First things first, let's gather our supplies. You may need to prepare some of these items separately if they are not included in the kit. Grab your clean trash can, a pericare or perennial kit or washcloth, a waterproof pad, and alcohol prep. Now, what's inside the kit? Items in your kit are stacked, depending on what you need first in order to maintain sterility. They should be pre-packaged and ready to go. You should have your CSR wraps, sterile drapes, sterile gloves, tweezers, cotton balls, or swabs, betadine, specimen cup,
in order to collect the samples,
10 cc sterile water syringe in order to inflate the balloon, lubricant, along with the Foley catheter and drainage bag. Here's the step-by-step guide to setting up a sterile field before catheter insertion. Number 1, always an NCLEX, perform hand hygiene. Wear your clean gloves. Remove the plastic cover of the kit. You can use this as a disposable bin. Place the unwrapped kit on a clean, dry surface. Place the waterproof pad under your patient. Perform pericare. You will want to ensure that perennial care is free of fecal matter. Now, for male patients, always assess if the patient is circumcised or uncircumcised. If uncircumcised, you're going to have to pull back the fold of the skin to reveal the urinary meatus and the glands of the penis to clean the area. Clean in the circular motion and use the first towelette to clean the urinary meatus. Use a second towelette to clean from the top and down to the base of the shaft. Use the third towelette to clean each side of the groin, scrotum, then down to the anus. Now, if you're a female patient, from top to bottom motion, concentrate on the urethral meatus and the labia minora area. Use the first towelette to wipe and clean the urethral meatus down to the anus. Repeat the step using the second third towelette in the peri-kit. Step 6. Remove and discard the gloves. Sanitize or wash your hands. Most kits contain hand sanitizer. Now, you're going to open the CSR and ensure it's in the correct orientation before opening. Your sterile working area depends on how the kit was packaged. Your sterile kit should first be opened away from your body, then towards yourself, followed by the side. It is important to remember that there are a lot of 1-inch border that is considered contaminated, and sterile items should remain in the center of your sterile field. Put on the sterile gloves, including in the kit. Remember, once the sterile gloves are on, you cannot touch anything outside the sterile field. Drape your patient. This is done to extend the sterile field. When draping, place the shiny side of the drape away from your patient, taking extra care not to touch any unsterile surface causing contamination. Put the finished straightened drape that has a hole to expose the patient's genitals. Open the iodine from the Foley kit, then pour it on the swab or cotton balls. Attach the saline syringe to the Foley catheter. The last and final step is to dispense the lubricant to lubricate the tip of the catheter, thus making insertion easier. And with all those steps together, we are ready to go. We are fully sterile and ready to insert the Foley catheter. Now, if you need help on insertion of a Foley catheter or straight catheter, I'd like to refer to my next video in regards to males and females catheter insertion, whether it's straight or Foley.
Thanks for watching. If you found this video useful, don't forget to like, share, and subscribe for more medical information, and to really help you on your next exam.